Welcome to Sacto Career 2.0 online nursing channel. In today's video, we are going to see some of the important questions for all nursing officer exams. This video contains 50 questions, so please don't skip the video. Watch all the 50 questions so that it will update your knowledge. We are going to learn some of the new things also in this video. If you have not yet subscribed to our channel, please subscribe to Sacto Career 2.0 online nursing channel now. Let's see the first question of the day. Lewy bodies are found in the substantia nigra neurons in option A. Alzheimer's disease, B. Parkinson's disease, C. Huntington disease, D. Pick disease. In which condition there is Lewy bodies which is present in substantia nigra of the neurons. The right answer is Parkinson's disease is characterized by the presence of Lewy bodies in the substantia nigra of the neurons. Question number 2. A 60-year-old patient with a past history of treated pulmonary tuberculosis presents with massive hemoptysis. What is the most likely cause for hemoptysis? Option A. Pulmonary amyloidosis, B. Aspergilloma, Option C. Bronchiolith, Option D. Relapse of TB. So in which condition there will be massive hemoptysis in a 60-year-old patient who has a past history of pulmonary tuberculosis? Hemoptysis. There is blood in the while coughing. The right answer is Aspergilloma is a condition which will have this problem. The rationale: infection of inactive tubercular activities by Aspergillus fumigatus give rise to solid moss-like lesions inside the cavity, that is called as Aspergilloma. Mostly it gives rise to hemoptysis which may be massive. So the inactive tubercular activities gets activated by Aspergillus fumigatus. That condition is called as Aspergilloma. Question number 3. Which of the following illness increases the risk of developing tuberculosis? Option A. Anthracosis, B. Berliosis, C. Sarcoidosis, D. Silicosis. The condition which increases the risk of developing tuberculosis. The right answer is silicosis. Silicosis increases the risk of developing tuberculosis. The rationale: silicosis results from the inhalation of silica, usually in the form of quartz, by workers grinding and polishing stone. Silicosis is associated with eggshell classification of lymph node, and silicosis is characterized by the increased risk of tuberculosis, that is called as silicotuberculosis, and it is also present with lung cancer and chronic obstructive pulmonary disease. That's why the condition associated with pulmonary tuberculosis, silicosis. Question number 4. The commonest cause of chronic renal failure is A. Diabetes mellitus, B. Hypertension, C. Pyelonephritis, D. Cystic disease of kidneys. Which condition is mostly common in causing chronic renal failure? The right answer is diabetes mellitus. Diabetes mellitus is the priority cause for chronic renal failure. The research study shows that diabetes mellitus type 2 accounts for 20 to 40% of chronic renal failure causes, followed by the hypertension, which is between 5 to 25% of the chronic renal failure causes in the world. That's why diabetes mellitus is the most commonest cause of chronic renal failure. Question number 5. Square root sign is a characteristic of option A. Dilated cardiomyopathy, B. Restrictive cardiomyopathy, C. Constrictive pericarditis, D. Cardiac tamponade. Square root sign is the indication of Which condition? The right answer is constrictive pericarditis is expressed by the square root sign in the case sheet by the physician. In constrictive pericarditis, the ventricular pressure pulses in both ventricles exhibits characteristic square root sign during diastole. That's why it is represented as square root sign. Question number 6. Following statements regarding ulcerative colitis is true. Option A. Smoking has a protective effect. B. Smoking does not have a protective effect. Option C. There is no relation to smoking. Option D. Smoking causes relapse. The right answer. Smoking has a protective effect related to ulcerative colitis. It is very abnormal. What we expect from that, it is totally opposite. Smoking has a protective effect. Usually we say smoking has adverse effect, but in ulcerative colitis smoking has a protective effect. The rationale: ulcerative colitis is more common in non-smokers and ex-smokers. Smoking may prevent ulcerative colitis. Smoking is associated with a twofold increased risk of Crohn's disease. Smoking is associated with a twofold increased risk of Crohn's disease, but in ulcerative colitis, smoking acts as a protective factor, and in ex-smokers, there is no chance of ulcerative colitis. Question number 7. The use of 5% dextrose as an intravenous resuscitation fluid can: Option A. Improve cerebral perfusion. B. Provide glucose substrate for cerebral metabolism. Option C. Reduce intracranial pressure and cause laxity of brain. Option D. Reduce serum osmolality and cause brain edema. So what is the function of 5% dextrose when we administer through intravenously in fluid resuscitation? The right answer: it reduces serum osmolality and causes brain edema. It reduces serum osmolality and causes brain edema. So you have the rationale here. 5% dextrose in water is unique in that it may categorize as both an isotonic and hypotonic solution. Dextrose water should not be used in isolation to treat fluid volume deficit because it dilutes plasma electrolyte concentration. It is also contraindicated in these clinical circumstances for resuscitation because the solution would remain in the intravascular space in the early postoperative period because the body's reaction to the surgical stress may cause an increase in antidiuretic hormone secretion. Question number 8. Delivery of head in normal labor is by the following movement: Option A. Flexion. Option B. Extension. Sorry. Option C. Rotation. Option D. Restitution. Delivery of head in normal labor is by the following movement. The right answer is extension. Delivery of head takes place by extension through couple of force theory. The principal movement in normal labor is engagement, descent, flexion, internal rotation, crowning, extension, that is delivery of the head, followed by restitution, external rotation, and expulsion of the trunk. That's why we choose the answer extension here. Question number 9. The following conditions are associated with endometriosis except: Option A. Anovulation. B. Luteinized unruptured follicle. C. Hyperprolactinemia. Option D. Hypothyroidism. So which condition is associated with endometriosis? The right answer is option D. Hypothyroidism is the condition which is associated with endometriosis. Ovulation disorders in patients with endometriosis includes anovulation, hyperprolactinemia, abnormal follicular genesis, premature follicular rupture, luteinous unruptured follicles, luteal phase defect. Note: hypothyroidism, chronic fatigue syndrome, and fibromyalgia are common in endometriosis patients. However, it is not having a direct association. Question number 10. Human chorionic gonadotropin levels are increased if the fetus is having option A Down syndrome, option B anencephaly, C hydrocephalus, D spina bifida. So in which condition HCG level increases? The right answer is option A. When the baby is having Down syndrome, the HCG level is abnormally high. Increased HCG level are associated with multiple pregnancy, hydatid form mole, choriocarcinoma, and Down syndrome in fetus. Question number 11. A woman presents with 10 weeks of amenorrhea, pain, and bleeding. On examination, the uterus is 10 weeks size, soft and internal, was open. Orifice is open. The diagnosis is option A threatened abortion, B missed abortion, C ectopic pregnancy, D inevitable abortion. 10-week pregnant woman, who is having pain, bleeding, and on examination, orifices 10 weeks, orifices open, internal orifices open. The diagnosis shows that the client have inevitable abortion. Inevitable abortion is a clinical type where the changes of pregnancy have progressed to a state from where continuation of pregnancy is impossible. The clinical features include increased vaginal bleeding, lower abdominal pain, dilated external orifice of cervix through which products of conception are felt. Now let's see question number 12. Most likely causes for amenorrhea in cases of vesicovaginal fistula is option A Asherman syndrome, B hypothalamic suppression, C nutritional, D infection. The most likely causes for amenorrhea in cases of vesicovaginal fistula. The right answer is hypothalamic suppression. The most causes of amenorrhea in vesicovaginal fistula are secondary amenorrhea due to hypothalamic suppression. Question number 13. Pharmacological closure of patent ductus arteriosus in a premature infant is by administration of option A aspirin, B estrogen, C brufen, D prednisolone. So how we get the closure of patent ductus arteriosus pharmacologically in a premature infant? That is achieved by the administration of brufen. The rationale: indomethacin or brufen is often tried for pharmacological closure of patent ductus arteriosus. Question number 14. The guidelines for immunization against infectious disease includes all of the following except option A. Live vaccines are contraindicated in pregnant women. Option B. Live vaccines should not be administered within 3 months of giving human immunoglobulin. Option C. Inactivated vaccine should not be given if there has been significant reaction to previous dose. Option D. Hay fever, sickle cell anemia, and tuberculosis are contraindications for vaccination. So, which statement regarding immunization is true except infection includes all except the right answer is option D. Hay fever, sickle cell anemia, and tuberculosis are contraindication for vaccination. So, contraindications for administering vaccines include pregnancy, immunodeficiency, vaccines after administration of immunoglobulins is contraindicated for at least 3 months. Inactivated vaccine should not be given if there has been significant reaction to previous dose, toxigenic reaction. Hay fever, sickle cell anemia and TB are relative contraindications sometimes, but it is not contraindication all the time. Question number 15. Respiratory syncytial virus causes all of the following in children except option A bronchiolitis, option B crow, C pneumonia, D rhinosinusitis. Respiratory syncytial virus causes all of the following in children except the right answer is rhinosinusitis. What are the diseases caused by respiratory syncytial virus? Bronchiolitis, pneumonia, cough, upper respiratory diseases, particularly coryza and common cold. So this condition, rhinosinusitis, is not caused by respiratory syncytial virus. Move on to question number 16. Peripheral nerves can withstand ischemia up to option A 30 minutes, B 1 hour, C 3 hours, D 4 hours. So how long peripheral nerves can withstand without supply of blood? The right answer is for 3 hours. For 3 hours, peripheral nerves can withstand ischemia. Very interesting. Next question. Shield cataract is seen in option A diabetes, B atopic dermatitis, C neurofibromatosis type 2, option D galactosemia. So in which condition shield cataract is seen? The right answer is option B atopic dermatitis. Atopic dermatitis is associated with presence of shield cataract. You can see there are 17 types of cataract. So different types of cataract apart from shield cataract includes oil drop cataract, diabetic cataract, blue dot cataract, radiation cataract, steroid induced cataract, sunflower cataract, traumatic cataract, complicated cataract, Christmas tree cataract, glass blown cataract, nuclear cataract, zonular cataract, snowflake cataract and rubella cataract. These are the other types of cataract apart from shield cataract. Shield cataract usually caused by atopic dermatitis. Okay, now let's see the question number 18. Massive retinal hemorrhage are seen in option A central retinal artery occlusion, B central retinal vein occlusion, C carotid artery occlusion, option D branch artery occlusion. Massive retinal hemorrhage in a client is due to, the right answer is central retinal vein occlusion. Central retinal vein occlusion causes massive retinal hemorrhage. In central retinal vein occlusion, all the veins of the retina becomes enormously engorged with blood and extremely tortuous, and the retina is covered with extensive hemorrhages. Question number 19. In electroretinogram, the A wave is generated by, in electroretinogram, the A wave is generated by option A rods and cones, option B retinal pigment epithelial cells, option C anterior lens cells, option D amacrine cells. So in electroretinogram, the A wave is generated by, the right answer is option A rods and cones. The rationale. Electroretinogram has three waves, A wave, B wave, C wave. The A wave is due to photoreceptor cells like rods and cones activity. B wave is due to the response of bipolar cells. C wave is generated by the retinal pigment in the epithelium and related to retinal metabolism. Move on to question number 20. Seborrheic dermatitis is frequently seen in. Seborrheic dermatitis is frequently seen in option A lipid storage disorders, B psoriasis vulgaris, C hypertension, D Parkinson's disease. In which condition there is seborrheic dermatitis. The right answer, it is commonly present in Parkinson's disease. Seborrheic dermatitis is commonly present in Parkinson's disease. Seborrheic dermatitis is a common chronic disorder characterized by greasy scales overlying erythematous patches or plaques. It is frequently seen in patients with Parkinson's disease, in those who have had cerebrovascular accident, and in those with HIV infection. The vast majority of individuals with seborrheic dermatitis have no underlying disorder. Question number 21. Post-spinal headache is due to option A. Injury to spinal cord, B. CSF leak from dura, C. Meningitis, D. Raised intracranial pressure. Post-spinal headache is due to, the right answer is CSF leak from dura. CSF leak from dura. Post-spinal headache is seen as a complication of spinal anesthesia, that is during dural puncture. Causes is CSF leaking from dural puncture would lead to loss of CSF pressure, tension, and the meninges and other intracranial structures will have some kind of tension. Usually, occipital, the headache is in the occipital region, and it is relieved on lying down for at least 7 to 10 days. Question number 22. Contraindications to nasotracheal intubation is option A. Basilar skull fracture, B. Severe otitis media, C. Labyrinthitis, option D. Pituitary microadenoma. So, which is the contraindication for nasotracheal intubation? The right answer is basilar skull fracture is the contraindication for giving nasotracheal intubation. The rationale. Common contraindications include bleeding disturbances, epistaxis, deviated nasal septum, polyps, basal skull fracture, CSF leakage, nasal stenosis, and chronic sinusitis. These are the contraindications for endotracheal intubation. Question number 23. The only atypical antipsychotic drug that is indicated to reduce the risk of suicide is option A. Clozapine, B. Ciprasidone, C. Risperidone, D. Asinapine, which is the antipsychotic drug which reduces the risk of suicide. The right answer is clozapine. Clozapine is the antipsychotic drug which reduces the risk of suicide. Clozapine. Clozapine is the only antipsychotic drug that has received FDA approval for treating recurrent suicidal behavior to patients with schizophrenia and schizoaffective disorder. So keep in mind, when a patient is having suicidal ideation or suicidal behavior, administer antipsychotic drug clozapine. It has the suicide reducing effect. Question number 24. Rest leg syndrome is commonly caused by addiction to which of the following? Rest leg syndrome is commonly caused by addiction to which of the following? A. Caffeine, B. Cocaine, C. Cannabis, D. Opium. The right answer is caffeine addiction causes restless leg syndrome. The common causes of restless leg syndrome includes idiopathic. Mostly it is idiopathic. The cause is unknown. Chronic renal failure and deficiency anemia. Other causes of restless leg syndrome includes pregnancy, neuropathy, peripheral multiple sclerosis, Parkinson's disease. Drugs such as caffeine, benzodiazepine, barbiturates, antipsychotics, and alcohol also causes restless leg syndrome. Question number 25. Which of the following is a necessary criteria to diagnose a depressive episode? The necessary criteria to diagnose depressive episode. Option A. Past history of mania. B. Suicidal attempt. C. Presence of stress. D. Depressed mood for a minimum 2 weeks of duration. So, which is the most common criteria to diagnose depressive episode? The most common diagnosing criteria for depressive episode is option D, depressed mood for minimum 2 weeks of duration. That is the most common criteria for diagnosing a depressive episode. Depressed mood for a minimum 2 weeks of duration. Question number 26. 8-year-old boy complains of something crawling inside my head. He was conscious with no eye blinking. The most likely diagnosis is option A, simple parietal seizure, simple partial seizure, B, tics, C, migraine, D, dissociative disorder. So something crawling inside my head, but client is conscious and no eye blinking, that indicates the simple partial seizure resulting from an irritable focus in the cerebral cortex. Simple partial seizure do not alter the patient's consciousness. This may be classified as motor and somatosensory. In somatosensory, visual, olfactory, auditory sensations are involved. The specified symptom is commonly seen in this type. In somatosensory, this type is seen. That's why it is associated with simple partial seizure. Question number 27. Which is true of schizophrenia? Option A. It is characterized by pure negative symptoms. B. Positive part occurs in the lateral part of the illness. C. There is pathognomic feature for the diagnosis. Option D. Marked variability in the course of symptom is common. So which is true of schizophrenia? The right answer is option D. Marked variability in the course of symptom is common. So we have different types of schizophrenia. All the types of schizophrenia are not similar. It has different variability in the signs and symptom and the course of illness also. Question number 28. Study of lip prints is known as. So it is a question related to forensic nursing. Study of lip prints is known as option A, poroscopy, B, rogoscopy, C, chelioscopy, and D, oroscopy. The right answer is chelioscopy is the study of lip print, like fingerprint. Lip print is studied by chelioscopy. The rationale, you have chelioscopy is the study of lip prints, poroscopy, examination of impressions left by the sweat pores of fingers to check or support fingerprint evidence. Rogoscopy, the observation and study of the patterns of the grooves, wrinkles and ridges of the palate to identify individual patterns. Option, the oroscopy is examination of buccal cavity. So it is a forensic nursing related question. Question number 29. Declaration of Tokyo deals with. This is also related to forensic nursing. Declaration of Tokyo deals with option A, abortion, B, torture, C, human experimentation, D, consumerism. The right answer is option B, torture. Like this, there is Declaration of Helsinki, that is in research ethics we study, that is deals with human experimentation. So without consent, we cannot use any person in the sample for research. So Declaration of Tokyo guidelines for medical professional concerning torture and other cruel, inhuman and degrading treatment or punishment in relation to detention or imprisonment. It is adopted by World Medical Assembly, Tokyo, Japan, 1975. So it deals with torture. Question number 30. A night blood survey is done in option A, malaria, B, filariasis, C, plague, D, dengue. So night blood survey is done in filariasis. The rationale, in filariasis, a considerable proportion of people are symptomatic, although their blood is positive for microfilaria. They may remain without any symptom for months or years. They are an important source of infection in the community. These carriers are usually detected by night blood examination. Move on to question number 31. Which is a true of lithium? Which is true of lithium antimanic drug? Option A, it is extensively protein bound. Option B, it is excreted unchanged by the kidneys. Option C, it is exchanged for potassium by the kidneys. Option D, it often causes hyperthyroidism. Which is true of lithium? The right answer, option B, it is excreted unchanged by the kidneys. It is excreted. How unchanged by the kidneys? How we take in which form? In the same form it is excreted outside without undergoing any metabolism in the kidney. Question number 32. Salivary centers are located. Salivary centers are located. Option A, spinal cord. B, medulla. C, hypothalamus. D, cerebellum. Salivary centers are located in the medulla as well as hypothalamus. Some part of the salivary glands are present in the medulla, others are present in the lateral part of the hypothalamus. Question number 33. The normal daily excretion of uric acid ranges from option A 10 to 30 milligram, option B 50 to 70 milligram, option C 100 to 300 milligram, option D 500 to 700 milligram. The normal daily excretion of uric acid ranges from, the right answer is 500 to 700 milligram. Only 6 to 12 percentage of the original filtered uric acid is excreted in the urine, which amounts for 400 to 800 milligram, which is excreted in our urine daily. Question number 34. The most common cause of severe hypercalcemia is option A, vitamin D toxicity, B, sarcoidosis, option C, chronic renal failure, D, malignancy. The most common cause of severe hypercalcemia. The right answer is option D, malignancy. Malignancy is the most severe common cause for hypercalcemia. Chronic hypercalcemia most commonly caused by primary hyperparathyroidism as opposed to the second most common etiology of hypercalcemia is an underlying malignancy. So if hyperparathyroidism is given in this option, you can choose that. But next to that, the secondary cause is malignancy. Question number 35. Investigation of choice in bronchiectasis is option A, bronchoscopy, B, MRI thorax, C, HRCT lung, option D, chest x-ray. In bronchiectasis, the most common investigation preferred by the doctor is option C, HRCT lungs. That is higher resolution CT scan. CT, especially with high resolution images, HRCT 1.0 is equal to 1.5 mm thick, provides an excellent view of dilated airways. Consequently, it is now the standard technique for detecting or confirming the diagnosis of bronchiectasis. Question number 36. Kaisernood forest disease is transmitted by option A, fleas, B, mosquitoes, C, ticks, D, mites. The right answer is ticks. Kaisernood forest disease is transmitted by ticks. Kaisernood forest disease is a viral hemorrhagic fever found in Mysore, India and Western Siberia forest. Question number 37. Niacin should be avoided in patient with option A, peptic ulcer, B, hypertension, C, Alzheimer's disease, D, Parkinsonism. In which patient we avoid administering niacin? The right answer is patient with peptic ulcer. We won't administer niacin. Niacin, nicotinic acid, is a B group vitamin whose lipid lowering property is unrelated to its vitamin activity. Its amide derivative, nicotinamide, uh, vitamin B3 is ineffective because the lipid changes during niacin therapy. Question number 38. A 38-year-old lady presented with dysphagia, nocturnal asthma, and weight loss for 6 years. The most probable diagnosis is option A, achalasia cardia, B, light structure esophagus, C, gastroesophageal reflux disease, D, cancer esophagus. So conditions associated with this diagnosis include dysphagia, nocturnal asthma, and weight loss for 6 years. Then the probable diagnosis would be achalasia cardia. In achalasia cardia, the patient is typically aged 30 to 40 years and the condition is slightly more common in females. Signs and symptoms includes progressive dysphagia, regurgitation of stagnant undigested food, aspiration occurs at night, when patient lies down and it results in a fit of coughing, recurrent chest infections due to respiratory respiration anemia, and there may be loss of weight also. Question number 39. Freshwater swimming can lead to option A, brucellosis, B, leptospirosis, C, babesiosis, D, Lassa fever. Freshwater swimming can lead to, the right answer is leptospirosis. The rationale: leptospirosis is caused by exposure to several types of Leptospira bacteria, which can be found in fresh water that has common that has been contaminated by animal urine. It occurs in warmer climates. Question number 40. Persistent priapism is rarely seen as a consequence of option A, sickle cell anemia, B, leukemia, D, spinal cord disease, option D is prolonged sexual activity. Persistent priapism is a rarely seen in which condition? Option C, spinal cord disease. Priapism is a painful erection. It is due to infraction of the penile venous outflow tracts. It causes permanent impotence, and it is associated with sickle cell anemia, leukemia, hypercoagulable states, spinal cord injury, and injection of vasodilator into the penis. So rarely it is present in spinal cord injury. Question number 41. Hepatitis B virus is not present in A, milk, B, sweat, C, lymph, D, stools. So hepatitis B virus is not present in the right answer is lymph. So where the although HBsAg does not reveal the whole infective HBV particle, it can be detected in all kind of human secretions, including blood, serum, saliva, tears, sweat, urine, semen, vaginal secretions, and maternal milk. So in lymph, HBsAg will not be present. Question number 42. Stress-induced ulcers are commonly found in option A, fundus of stomach, B, antrum of stomach, C, pyloric channel, D, first part of duodenum. Stress-induced ulcers are commonly found in, right answer, fundus of stomach. Patients suffering from shock, sepsis, massive burns, that is Curling's ulcer, severe trauma, head injury, Cushing's ulcer can develop acute erosive mucosal changes in the gastric or frank ulceration with bleeding. Classified as stress-induced gastritis or gastric ulcers, injury is most commonly observed in the acid-producing fundus and body portion of the stomach. That's why the fundus part of the stomach is the right answer associated with stress-induced ulcers. Question number 43. The ideal replacement for esophagus after esophagectomy is option A, stomach, B, jejunum, C, colon, D, synthetic stent. So, in esophagectomy patient, which is the ideal replacement? The right answer is stomach is the ideal replacement. Several organs have been used to conduits the replace the esophagus after esophagectomy, like stomach, colon, jejunum, and myocutaneous grafts have been tried, but the stomach is an overwhelming favorite among all these organs. Question number 44. The most common cause of epididymitis is option A, gonococcal infection, B, chlamydia infection, C, proteus infection, D, tubercular infection. The most common cause of epididymitis is option B, chlamydia infection. Acute epididymitis is almost unilateral, produces pain, swelling, and tenderness of epididymis with or without symptoms of single or urethritis. In sexually active men under age of 35, acute epididymitis is caused most frequently by Chlamydia trachomonatis and less commonly by Neisseria gonorrhea. That's why we chose Chlamydia trachomonatis as the most common cause of epididymitis. Question number 45. The most important prognostic factor of carcinoma breast is option A, tumor size, B, DNA content of tumor, C, histologic subtype, D, tumor grade. The most important prognostic factor of carcinoma breast is option A, size of the tumor size. The number of axillary lymph node involved is the most important predictor of outcome after nodal status, and tumor size is the most important prognostic factor in detecting the prognosis of breast cancer. Question number 46. The class of antihypertensive drug which is contraindicated in pregnancy is option A, central sympatholytics, B, calcium channel antagonists, option C, beta blockers, option D, angiotensin converting inhibitors. So, which is the most common contraindicated antihypertensive agent in pregnancy? The right answer is angiotensin converting enzyme inhibitor (ACE) inhibitor is contraindicated in pregnancy. Antihypertensive drugs to be avoided during pregnancy is diuretics, ACE inhibitors, non-selective beta blockers, and sodium nitroprusside. Antihypertensive drugs safer during pregnancy include hydralazine, methyldopa, cardioselective beta blockers, prazosin, and clonidine. Question number 47. Vulvovaginitis in children could be due to any of the following except option A, worm infestation, B, forgotten foreign body, option C, estrogen deficiency, D, chlamydia infection. Vulvovaginitis in children is due to the any of the following except the right answer is estrogen deficiency. Estrogen deficiency is the right answer. Vulvovaginitis in children may be due to foreign body inserted in the vagina, threadworm infection, gonococcus E. coli, trichomonas vaginalis, candida, and chlamydia. Estrogen deficiency causes senile vaginitis, most commonly seen in postmenopausal women. So, estrogen deficiency does not cause vulvovaginitis in children. It causes the senile vaginitis in the postmenopausal women. Question number 48. Hematospermia is due to option A, damage of blood testis barrier, option B, testicular malignancy, C, infection of testis, D, infection of urethra. So hematospermia is due to, the right answer is infection of urethra, that is blood in the sperm is called hematospermia. It is due to infection of urethra. So hematospermia is defined as blood in the semen. Common causes include congenital causes, ejaculatory duct cyst, obstructive causes, benign prostate hypertrophy, urethral stricture. Vascular causes include excessive sexual intercourse and masturbation. Systemic causes include hypertension, cirrhosis of liver, tumors. The causes are prostate, bladder tumor, and testicular tumors. Trauma includes perineum damage and testicle injury. Infectious causes include urethritis, prostatitis, and epididymitis. Question number 49. In early pregnancy, the doubling time of the concentration of human, option A, chorionic gonadotrophin in plasma is, in early pregnancy, the doubling time of concentration of human chorionic gonadotrophin in plasma is option A, 1 day, B, 2 days, C, 3 days, and D, 4 days. The right answer is option B, 2 days. In early pregnancy, the doubling time of the concentration of HCG in plasma is 1.4 to 2 days. Question number 50. Characteristic fetal anomaly in maternal diabetes is option A, sacral agenesis, B, anencephaly, C, transposition of great vessels, option D, renal agenesis. So characteristic features in fetal anomaly in maternal diabetes due to maternal diabetes will be option A, sacral agenesis. Let's see the explanation. Chance of major congenital malformation is more if HbA1c value in the first trimester is above 9.5%. Major congenital birth defects in infant of diabetic mother includes sacral agenesis, ventricular septal defect, atrial septal defect, coarctation of aorta, renal agenesis, hydronephrosis, single umbilical artery, duodenal atresia. So sacral agenesia is the right answer. So now the most waiting subscriber challenge question is a question for our subscriber to answer in the comment box. It is a type of motivation for all our subscribers. The question here, student's elbow is option A, trochlear bursitis, B, olecranon bursitis, option C, lateral epicondylitis, option D, medial epicondylitis. So student's elbow, which is known as the right answer, you comment in the comment box below. Thanks for watching this video. Hope to meet with another good questions. Subscribe to Satu Carry Online Nursing channel. Now, please like this video and comment about this video. Thank you. Bye bye.